Back after 24 children found dead after consuming killer cough syrup, a nationwide probe has now been launched in this particular case, according to a recent CAG report, which has been accessed exclusively by NDTV in the years 2016, 2017 and 2020 till 2021. The state drug regulator consistently fell short of its inspection targets, raising serious concerns about the efficacy and safety of drugs being manufactured and distributed in these states. Meanwhile, in the center of this controversy is the Pharma boss, the owner of Tamil Nadu-based pharmaceuticals company, who was arrested from Tamil Nadu by the Madhya Pradesh police, and he has now been shifted to Nagpur. The CAG had flagged these shortfalls last year, but no significant action was taken. The lack of regular inspections and quality testing has in fact led to questions about the oversight and accountability of the state's drug regulatory framework. Meanwhile, the Tamil Nadu Health Secretary has also reacted to the lapses found in the CAG report. Listen in to what he said.
Did the government fail to learn lessons after the CAG report, sir?
It is periodically inspections are being done. So from 2021 and 2022, inspection has been done by the state drug authorities on this firm, and follow-up action including penalty have been levied on this. So the last 2 years there was lapse, and for which action has been taken on the...
This was flagged by CAG report last year. Yeah. Didn't we learn lessons and intensify?
Government has been conducting periodic inspections and taking follow-up action. Other places, intensive inspections have been already ordered, and they are already doing them.
What specific violations have come to light, sir, from this plant, recent plant?
A number of violations have been reported, and follow-up criminal action has...
Around 300? Around 300?
So has the license of street...
Shortage of inspectors a problem, sir? Shortage of inspectors?
No. Recently, government has also recruited almost 90 drug inspectors for the drug department.
All right, let me go across to my colleague Sam Daniel, who joins us right now to get us more on this. Sam, elaborate on the CAG report's findings, especially regarding the state drug regulators' inspection targets, and how might this have impacted the drug safety in Tamil Nadu?
Osama, now that it's clear that Tamil Nadu drug control authorities have failed to carry out the mandatory inspection at this particular plant outside Chennai, the cough syrup made from there has now resulted in the death of at least 20 children. Going by the CAG report that was submitted last year, between 2016 and 2021, there's been a shortfall of both inspections by drug authorities and drug samples collected. In the case of inspections, it goes up to 40% between 2016 and 2021. In the case of the samples, it goes up to 54% between 2016 and 2021. When we raised this particular issue to the health minister, he says this period comes under the AIADMK regime earlier. This ought to be answered by the then Chief Minister EPS. But for a specific question that the CAG had flagged this to the present ruling DMK in Tamil Nadu as early as last December, shouldn't the government have plugged these loopholes, made sure these pharmaceutical companies and plants are thoroughly inspected and drug samples taken? He conceded that over the last 2 years there's been a lapse. 2 senior drug inspectors have been suspended. He also adds that it's just not the state drug inspectors who have failed in their duty, but also the mandatory inspection by once every 3 years by central drug inspectors also has not been done, and there's been failure both on the parts on the sides of the state and central authorities. Now heads have begun rolling, 1 person arrested and 2 senior drug inspectors suspended. But the larger question, who's responsible for the loss of these 20 little children in Rajasthan and a few other places? And authorities say a complete audit is being done. The larger issue also, it's just not Tamil Nadu specific, Osama. This is the case across India. For example, in the case of Rajasthan, the CAG report cites shortfalls much higher than Tamil Nadu. And this requires urgent attention to make sure India, which is being seen as the pharmacy to the world, is complying with the highest forms of standards, and also to make sure Indian consumers too are not exposed to such risks leading to loss of lives like in this case.
Absolutely. Sam, thank you very much for getting us all those details. It's not just in Tamil Nadu, but in an important report that was tabled in the Madhya Pradesh Assembly on the 18th of December last year, the CAG had highlighted the mismanagement of important drug stores, especially in Chhindwara district. This report specifically said that the physical verification of store was not even carried out even once in Chhindwara Institute of Medical Sciences, Chhindwara, during the 2018 till 2022. Now, we have also accessed the Rajasthan government CAG report, which also reveals discrepancies in drug store management. And my colleagues Vishwas Sharma joins us from Jaipur. I also have Anurag Dwari joining us from Madhya Pradesh. Vishwas, to you first. What specific discrepancies have been noted in the drug store management in Rajasthan? And more importantly, what actions are being taken to address these issues?
Rajasthan, the 35% doctors are not available in Rajasthan, and various health gaps are presented here. And we have also tried to ask the Health Minister Gajendra Singh Khewsar about this issue. So he said we are trying to fill these gaps, and we are hiring the manpowers, and 50,000 vacancies we are hiring. But here is a serious irregularities in the drug control thing, that drug control officers who have to done 94,800 inspections in the period of 2016 to 2022, they have only done 65,000 inspections. So it is around a 31% shortfall of the inspections, and due to this irregularities in the inspection, this kind of serious consequences we have seen in the last few days, that due to the cough syrup, the poisonous cough syrup, 4 children have died in the state of Rajasthan, in Sikar, Bharatpur, and in so many districts. So we can see how much dangerous, how much serious irresponsibilities, irregularities this kind of department and the whole employees and the administration have shown in this matter. And in the health infrastructure, we have also seen various kind of irregularities in the SMS fire incident. We have seen these kind of irregularities in the SMS eye incident. We see.
Right. In fact, this is a big question mark on the regulatory framework as well. And when we speak about it, Anurag Dwari, how do these findings reflect on the regulatory oversight, especially, and the monitoring of the drug stores in these states, particularly in Madhya Pradesh? What are the steps that are being taken to strengthen this oversight?
Sama, just give me, I just want to give you one quick update that the Shrisan Pharma owner is still inside the Parasia police station, and the court is hardly 200-300 meters away from there, so he'll be soon produced there. As far as the regulatory mechanism is concerned in Madhya Pradesh is also lagging behind. We have only 80 drug inspectors, and they are, managing the entire population of more than 8 crores in Madhya Pradesh, and that's why we have seen the pendency. We have only 3 labs for testing these drugs in Indore, Bhopal and Jabalpur, where the pendency is around 5,500. So if right now they have seized more than 19 samples of Nestro-DS, cold drift and a few more drugs, but it will take another 14 months just to test these drugs. I just also wanted to highlight one of the key findings of the CAG, and they have said that the Madhya Pradesh Public Health Service Corporation continue to purchase, because this is a very serious matter, and distribute medicines that were explicitly banned by the government of India for human use, putting public health at serious risk. Between 2017 to 2022, the corporation entered into rate contracts worth rupees 1 crore 53 lakhs with pharmaceutical companies for these banned drugs, and further procured medicines worth around 23 lakhs through local tenders at the district level, bringing the total value of prohibited drugs purchased to around 1 crore and 75 lakhs. And they also said, rather they have warned, the CAG has warned that reckless procurement of banned drugs violates national drug laws and endangers millions who depend on the public healthcare system for safe and affordable medication. So, I mean, we have seen the lapses on the part of Madhya Pradesh government in this deadly cough syrup case, that even the samples were sent using simple ordinary registered post. But this is something criminal, that you are buying banned drugs from the government of India and distributing it in different hospitals, in government hospitals in Madhya Pradesh.
Absolutely.